Hi, my name is Tiara Bradford, and I am a first-year graduate student in Alabama A&M Social Work Program. The population of interest that I will be discussing are social workers and their clientele with no specific age range, but yet social workers and how they should engage with all clients across the lifespan, especially when dealing with complex situations that involve families. The name of my article is The Relationship Between Mindfulness and Emotional Intelligence as a Protective Factor for Healthcare Professionals. Two key points that were made. One was that emotional intelligence training is a benefit to the overall well being of workers. Um, in the study, the two researchers compiled about 197 cases that involved emotional training, and they reviewed the direct benefits that it had on the particular worker. And in most instances, it was a positive correlation between those who had emotional intelligence training and characteristics such as being able to better understand, to have clarity of thoughts, to be more mindful and aware of one's own thoughts and how to guide those thoughts and actions. Another key point that was made was that emotional intelligence training has stress reducing factors, as we know that the field of social work can be extremely stressful at times, and those who are able to master emotional intelligence have a greater ability to still analyze situations even within stressful settings, which in fact does take place a lot when dealing with families in social work, because there are so many different dynamics to have to digest when listening to client perspectives and including them in intervention planning. Um, Two implications for social work practice is that emotional intelligence training should be mandated for all people who wish to enter the field of social work. Emotional intelligence not only helps to better understand one's emotions, but to also improve communication and overall client satisfaction. Another implication for the social work practice is that the unique needs of families have to be assessed and addressed in a way that makes them feel heard, that makes them feel as though their social worker cares about their point of view and perspective and is not biased in any way regarding creating treatment plans. So the effect that emotional intelligence has on um, families is that it benefits social workers to grasp an understanding of emotional intelligence so that they can execute um, execute making plans for families and achieving whatever goals that they have set forth. In a lot of instances, people believe that the success of the welfare system, our welfare system, is dependent upon agencies and where children are placed alone and those families. However, having a competent social worker is a very important variable in the success and outcome of people and families who have to use our welfare system. And if more social workers become emotionally intelligent, able to use mindfulness within their practice, then that will lead to more positive outcomes and solutions for clients and families.